If someone snores, it is a sign of things being wrong. Essentially, they cannot breathe properly through their nose. But it is very difficult to correct. And usually it is not enough just to make the nose larger by, sometimes they operate in order to open the actual tube that runs down the nose. The real answer is because the patient hangs her mouth open. And the only cure to that is learning to keep your mouth shut. That, again, can be very difficult because when you're asleep, you don't remember to. The only really effective method I know is to wear an appliance which is uncomfortable if you drop your jaw. And there is such an appliance called the orthotropic appliance. The stage 3 actually trains people to keep their mouths shut. It's very effective, but it does require a lot of effort by the patient. Once they've learnt to keep their mouths shut, the snoring problems disappear. And it is a more healthy way of curing it than simply holding the mouth open to prevent the noise of snoring.